जी डॉक्टर, मैं शुरू करिए मैम।
ठीक है सर। आप सभी को मेरा नमस्ते। मैं डॉक्टर कल्पना भदौरिया, होम्योपैथिक मेडिकल एसोसिएशन के ऑर्गेनाइजिंग सेक्रेटरी, आज के वेबिनार में आप सबका स्वागत करती हूँ। इस मंथ के सेकंड संडे को ये वेबिनार जूम प्लेटफॉर्म पर रात को 9 बजे कंडक्ट किया जाता है दिल्ली होम्योपैथिक मेडिकल एसोसिएशन की तरफ से। आज के वेबिनार में और दिल्ली में होम्योपैथिक मेडिकल एसोसिएशन में जो लोग भी नए हैं, मैं उनको बताना चाहूंगी कि दिल्ली होम्योपैथिक मेडिकल एसोसिएशन का गठन डॉक्टर युद्धवीर सिंह सर ने 1932 में गठित किया था। डॉक्टर युद्धवीर सिंह सर दिल्ली के पहले हेल्थ मिनिस्टर थे। इन्होंने नेहरू होम्योपैथिक मेडिकल कॉलेज, दिल्ली पब्लिक लाइब्रेरी और बहुत सारी होम्योपैथिक डिस्पेंसरी का गठन भी किया था। डॉक्टर युद्धवीर सिंह सर दिल्ली होम्योपैथिक बोर्ड के पहले चेयरमैन के रूप में भी कार्यरत रहे। डॉक्टर युद्धवीर सिंह सर ने हमें एक नई दिशा दिखाई और होम्योपैथी में कार्य करने के लिए और उसे आगे बढ़ाने के लिए 1932 से लगातार दिल्ली होम्योपैथिक और मेडिकल एसोसिएशन दिल्ली पब्लिक लाइब्रेरी की सहायता से सीएमई और कैंप ऑर्गेनाइज करते आ रही है और होम्योपैथी को निरंतर आगे बढ़ाने के लिए कार्यरत है। कोविड के समय से ही आज तक वेबिनार लगातार कंडक्ट कर रही है ताकि हमारे होम्योपैथ्स, लर्नर्स, स्टूडेंट्स हर समय कुछ न कुछ नया सीखते रहें। मैं अपने आप को बहुत गौरवान्वित महसूस करती हूँ कि मैं आज दिल्ली होम्योपैथिक मेडिकल एसोसिएशन की ऑर्गेनाइजिंग सेक्रेटरी हूँ। दिल्ली होम्योपैथिक मेडिकल एसोसिएशन में और की डिटेल्स जानने के लिए आप सब लोग www.dhma.in वेबसाइट पर देख सकते हैं और कांटेक्ट कर सकते हैं 9711423617 नंबर पर। आज का वेबिनार स्टार्ट करने से पहले मैं रिक्वेस्ट करती हूँ हमारी स्वागत करती हूँ हमारी प्रेसिडेंट डॉक्टर श्वेता मैम का। वेलकम डॉक्टर श्वेता मैम।
Thank you, Dr. Kalpana, and thank you for the beautiful introduction of Delhi Homeopathic Medical Association. I welcome all the viewers and my executive team. Dr. Milind, are you there with us? Please start your video. Unmute yourself. नमस्कार सर, आपका बहुत बहुत स्वागत है दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के इस प्लेटफॉर्म पर। और मैं अपनी पूरी टीम की तरफ से आपका स्वागत करना चाहूंगी। और ये बहुत ही इट्स रियली ग्रेट कि आप हमारे साथ अपनी जो नॉलेज है, आप खुद अगर आगे आए हैं एज अ वॉलेंटियर कि मैं अपनी नॉलेज शेयर करना चाहता हूँ, तो ये एक बहुत बड़ी बात है। और डीएचएमए हमेशा हमारे बीच ऐसे होम्योपैथ्स का स्वागत करती रही है और अपने प्लेटफॉर्म पर मौका देती रही है। तो आपका बहुत बहुत स्वागत करती हूँ। ओवर टू यू डॉक्टर कल्पना। थैंक यू सो मच।
थैंक यू मैम। थैंक यू मैम। हमारे आज के स्पीकर डॉक्टर मिलिंद पोरे। डॉक्टर मिलिंद पोरे सर पुणे सतारा थाने में 29 ईयर से होम्योपैथी की प्रैक्टिस कर रहे हैं। ये पहले होम्योपैथिक चिकित्सक हैं जिन्होंने रूरल एंड रिमोट एरियाज में होम्योपैथी का प्रोपेगेट करने के लिए मोबाइल होम्योपैथिक क्लिनिक स्टार्ट किया। इन्होंने ट्रेनर और टीचर के रूप में होम्योपैथी और फर्स्ट एड में भी निरंतर काम किया। डॉक्टर मिलिंद के द्वारा होम्योपैथी में बहुत से बुक्स और आर्टिकल्स लिखे गए हैं, लाइक माय फेल्यूर एंड सक्सेस इन होम्योपैथी, होम्योपैथी फॉर वेटरनरी, थेरेपेटिक इन रोमेटिज्म, कॉन्साइज मटेरिया मेडिका। डॉक्टर मिलिंद बहुत अच्छे स्पीकर एंड काउंसलर भी हैं। हॉल ऑफ फेम और भारत ज्योति जैसे पुरस्कारों से इन्हें सम्मानित किया गया है। इंडियन रेड क्रॉस डिजास्टर मैनेजमेंट टीम, आईआरसी पुणे फायर ब्रिगेड के ये लाइफ टाइम मेंबर भी हैं। हमारा आज का टॉपिक है अंडरस्टैंडिंग कैलकेरिया सिलिकेटा। हाँ, आज एक बात और कहना चाहूंगी, हम यहाँ पर एफबी पर लाइव भी हैं, इसलिए यहाँ पर जो भी मेडिसिन या केस टेकिंग डिस्कशन होता है, प्लीज यहाँ पर जो भी मेडिसिन बताई जाती है वो केस टेकिंग पर बेस्ड होती है, तो कोई भी अपने फिजिशियन से कंसल्ट किए बिना कोई मेडिसिन ना लें। वेलकम डॉक्टर मिलिंद सर। आपसे अनुरोध करती हूँ कि आप आएं और अपना लर्निंग सेशन स्टार्ट करें।
जस्ट टू इंटरप्ट डॉक्टर करुणा, नंबर एक तो ये सेशन
यस।
जो है वो अभी पे अभी लाइव नहीं हो रहा है फिलहाल। और
ओके
डॉक्टर
सर।
मिलियन सर, प्लीज आप ना एक बार रीज्वाइन कर लीजिए क्योंकि आपकी स्क्रीन में कुछ प्रॉब्लम चल रही है। तो एक बार एग्जिट करके और दोबारा से ज्वाइन करिए सर उसको। डॉक्टर मिलियन सर, आप सुन पा रहे हैं?
हाँ, यस यस।
जी सर, आप एक बार एग्जिट करके दोबारा ज्वाइन करिए क्योंकि स्क्रीन में कुछ ओवरलैपिंग हो रही है।
ओके ओके।
इसी बीच में हम आप लोगों को बताते थे कि अगर किसी को कोई क्वेश्चन पूछना है तो प्लीज चैट में पूछते रहिए। या हम जब स्पीकर का जो सेशन है वो खत्म हो जाएगा उसके बाद हम आप लोगों को अलाउ करेंगे क्वेश्चन आंसर्स के लिए। बीच में कोशिश करिएगा कि इंटरप्ट ना हो। थोड़ी स्क्रीन शेयरिंग हो रही, ओवरलैप हो रही थी, उसकी वजह से हम लोग दोबारा से रिज्वाइन करवा रहे हैं अभी सर को। जी सर, अब ठीक है बिल्कुल। फिर क्या बात है?
नमस्कार शर्मा सर।
सर नमस्कार।
आई एम वेरी ग्रेटफुल टू Delhi Homeopathic Association to invite me for the seminar.
थैंक यू
This is
सर।
a very and actually when there was a group discussion in our you can hear me well, na? Hello.
सर ये सर वी कैन हियर,
यस सर।
बट जो स्क्रीन है वो अभी भी ओवरलैपिंग हो रही है। आपने दो मोबाइल्स में या एक ही जगह दो तो ओपन नहीं कर रखे हैं जूम को?
ठीक है। I'll see my assistant to do that.
जी।
But hello,
यस सर,
जी
यू
सर।
आर ऑडिबल। यस।
I am audible, na?
यस
Yes,
यस।
sir, you are perfectly audible, but the screen is overlapping. So, वहाँ कुछ दिक्कत नहीं।
I am at the remote area. I am with my mobile homeopathic clinic.
ओके ओके ओके, श्योर सर। आप अपनी स्क्रीन भी शेयर कर सकते हैं सर, हमने अलाउ किया हुआ है।
ठीक है, no problem.
जी।
Good. Is it okay now?
यस सर।
हाँ, ठीक है। Uh, in introduction, you have given us that mobile homeopathy clinic we started, and I am practicing in a very remote areas, in such areas where doctors are even not available. Homeopathy is not been introduced over there, and the thing was that during when I started my practice, I decided to start a practice in such an area where homeopathy is not available. We people go directly towards such areas where we have an access of patients, especially homeopathic doctors. बहुत सारे patients in remote areas, they give live cases where they read a remedy. We can read a remedy directly from their actions, from their verbal interrogation, and the interrogation gives the remedy directly. We'll start with Calcarea silicata immediately. I'm not giving any slides deliberately because Calcarea silicata is a combination of remedies and it has a vast action in homeopathy. Even though in our Matra Medicas, there are various aspects where we find. Hello.
Dear viewers, please mute yourself. Please go ahead, sir.
I feel that there is some unmute problem.
Yeah, now it's fine,
Yes,
sir.
sir.
Please proceed.
We fixed it, sir. Please continue.
Unmute everything. We will have a session of 10 minutes of question and answers.
Yes, sir. I am doing. Sir, please continue.
Hello. I'm not giving deliberately the slides of Calcarea silicata because the drug is given in our Matra America in a very short way. And the drug action is very vast. Very vast means somebody uses the miasma therapy of Hahnemann. First of all, I will make it clear that I practice on the way of miasms and Hahnemann way. I don't follow any of the methods which somebody says. Are you getting me? जो हैनेमन ने लिखा है, जो हैनेमन ने प्रीच किया है, वही मैं बोल रहा हूं. Hello. The important part in Calcarea silicata is this. Calcarea silicata is a combination of remedies which was proven by Dr. Kent, master. But he had some problem during silicata proving because he was doing experiments of homeopathic medicines. Plus, he was an isopathy doctor. He was an alternative practitioner. Calcarea silicata is a very combination of two drugs where you can find various aspects in a miasmatic cleavage. Are you understanding? Cleavage. Cleavage of miasm is the thing where sora, psychosis, syphilis comes together in a way. Basically, Calcarea silicata is a salt. We'll start with directly the way where we present a case of particular thing. Calcarea silicata is a very insecure person. Insecure. I'm saying two ways. Insecure He is insecure only for his own position. His position is important. It is different with Lyco, with Silica. Silica is finding herself or himself in a problem. But Calcarea silicata knows he can do it. But he is refined, or he is sensitive, or he is, I will say, very insecure towards the position of his life. I'll give an example. A rich person doing a very good job, but he has a problem in his life. It is there mapped in his head from the childhood, and the child is born with that thing, and he has there in his mind, and he makes a position, he falls down for that position. He always think, he always think of that position. Refinement in the case is of Calcarea silicata is his position in life. Position in life. He is insecure for position. मैं क्या कर सकता हूं अभी, मैं कर सकता हूं मगर मैं नहीं कर सकता. दोनों माइंड. He has a sora psychotic mind. Psychosis उनको बोलता है कि yes, you can do it, but the miasm in his head will give a refinement that you need a standard of living. You need a standard of living. If you are a big businessman, you have to maintain. You have to maintain that. वो maintenance के लिए he has the problems. The second part I will tell you in a way where when a woman, if you think Calcarea silicata is been nurtured in the pregnant woman's life, he will have the problems if the family history will have the refinement which is transferred to the child, and he will have sensitiveness to the refinement. So he will present you in first trimester very good reports. Your nowadays sonographies are done rampantly. So in sonographies, everything will be okay. And in 6 to 7 months, he will have usually the problems in brain areas, upper area of the body. Open fontanelles. Open fontanelles is a classical symptom of Calcarea silicata. When Calcarea carb doesn't complete the case, or I will say when a woman in her pregnancy life is hampered with all multivitamins, all the calcium supplements, Calcarea silicata is the best remedy in higher potency, not in low potency. Because higher potency will never harm both way. The duos, whichever it is there, means the pregnant lady and the baby, growing baby. Second part in a mind section or a mental section, I will tell you, they need magnetism. They need magnetism in a family bonding. Family bonding. It is very close, very, very, very close. It is very, very difficult to differentiate calcarea and silica, or calcarea silicata in the sense of calcarea. It is very difficult, but these are the points where you can think. Malnourishment child, वो child grow होता है. In the womb the child grow होता है, but he is overweight and he I don't feel any, maybe is a parasite in just a symbiotic relationship with mother and child. But if you want a calcarea silicata case in a particular case, to find calcarea carp, calcarea silicata, even I will add calcarea fos, where many allopathic drugs are being introduced. So open fentanyls is a marker in a womb of calcarea silicata. Womb of calcarea silicata. Malpresentation, mispresentation, ये सब आता है. You can give. I am not saying try. You can give. Don't try. You can give one dose. Calcarea silicata. Usually we go for pulsatilla. Usually we go for nacfomica. But calcarea silicata is the remedy which is best by all homeopathic doctors. This is a very good remedy, but it should be given in a very higher potency, not in a lower potency. Lower potency में it can prove the crude symptoms. Anticipation in all sense, anxiety in all sense, going for an interview, going for new work, gives you anxiety and anticipation, where you can compare lycopodium, you can compare nux, you can compare nux बाद में आता है, you can compare silica, because silica is very sensitive than calcarea silica. Going for the head symptom, mind symptom में I can talk in mind section at least for another 4 to 5 hours, but we'll make it a very head symptom. It has piercing pain usually on the vertex. It has occipital headache. It has a typical pain at 1 p.m. It is given in Boning-Olsen. Relation with Boning-Olsen के time calcarea silicata was not proven, but it is there कि combination में अगर drug दिया तो ये काम करते हैं. I don't know the history of this I was just reading CALCAREA SILICATA and I found this combination में दिया तो भी चलता है. For the eye symptom, CALCAREA SILICATA has deep-rooted miasmatic action because it is a salt remedy. All C remedies which come in line, but it has to be concised, it has to be enumerated as per miasmatic thing. That is my personal unusual experience. Nowadays, nobody talks on miasms. Eyes mein, I have seen in my 20 years of practice, CALCAREA SILICATA has corrected the refractory errors where the cataract अभी पक रहा है and the patient has a very low immunity, so give CALCAREA SILICATA in a very low dose. Here, low dose, because it has a capacity to stop the progression of cataract. CALCAREA SILICATA is also been seen in my cases where it has cured conjunctivitis during the phases where heat and cold जब आता है तब. Talking towards the ear complaints. Ear complaints are not been proven, but clinically, CALCAREA SILICATA ऑडिट हेलो जो स्टेशन ट्यूब होता है, स्टेशन ट्यूब का कैथार जो होता है, स्टेशन ट्यूब का कैथार निकल जाता है इन हायर पोटेंसी, टॉकिंग अगेन अबाउट द eye symptom, will go cyst. I have used CALCAREA SILICATA 0/3 means lentisimal potency in a drop way. Means I mixed CALCAREA SILICATA in a normal water, normal yani distilled water, and I gave that drops to the patient. The patient was of cyst in the eye. Here. It resolved within 1 day. These symptoms has to be proven clinically. Talking about nose. In nose, CALCAREA SILICATA has polyps. He has a sensitive nose. He's a very sensitive. I talked in the mind section. He's a very sensitive in the sense that where hot and cold temperature changes from hot to cold. Calcarea silicata helps it. Well, Hello. Sorry,
जी
there
सर।
was a problem.
सर आवाज आ रही
Sorry,
है हमें
there is
आपकी?
I think there is some problem with the network issue.
जी
I pardon you all. I was talking on nose. I was talking on nose symptoms. Calcarea silicata has a very peculiar polyps which are on the posterior nares. If you have a polyp on the anterior nares of your noses or in your sinuses, there is silica. But in posterior nares, calcarea silicata helps very good in cases of eye symptoms. I told you. I forgot to tell you about the conjunctivitis of calcarea silicata. Conjunctivitis of calcarea silicata is particular where lateral sides means these sides, these sides, calcarea silicata, these sides, silica. This is proving clinical symptoms and recurrent clinical symptoms. Coming again to the throat symptoms, plague. The plague of calcarea silicata is very, very thick. It is difficult to understand a plague or the sputum of silica, calibi, calcarea, calcarea silicata, sulfur, arsenic. These remedies follow well in a cleavage of a match. If you have a very good case, means case taking, you can easily differentiate calcarea silicata in a particular one consultation, because the mind section is very important. When a patient enters in your clinic and you have a confirmed symptom that the refinement, वो खुद बोलता है, खुद patient, I had this problem, I was very मेरा पोजीशन ऐसा है कि I have this problem, and because of this problem, I'm not doing properly. This is a state of calcarea silicata. State of calcarea silicata. Changes in the climate, you have to again differentiate stocks, calcarea silicata, silica, arsenic album. Draft of air, where specifically forget calcarea silicata in your mouth. Calcarea silicata is very close to restops, very closer towards expectorations in silica. Sometimes it is seen that the hypochondriac area where there are various aspects. I'm talking on throat. Again, I forgot to tell, it is very good remedy when initial hypothyroid cases comes to you. Go and interrogate the patient in only on mind. Just differentiate what is calcarea, what is silica, what is lycopodium, what is pulsatilla. They goes hand in hand. Again, coming, which I forgot, autism. I want to talk on stomach. I want to talk on various, just like our hepatical way, but it has also given good results in autistic childs. In autistic childs, when पोटी का ध्यान उसको आता नहीं है, पोटी का ध्यान यानी मुझे पोटी करना है at a stage of 7 years old child, उनको नहीं समझ में आता है मुझे पोटी करना है. Think in the mind, what is calcarea silicata? Take the case, you will find calcarea silicata is there. Take higher dose. Talking again on the cyanosis cases. Cyanosis यानी bluish discoloration of child. It also helps for insecurity for protection, insecurity for position. Talking on chest complaints, it has a phlegma, I told you. Now I will come to the extremities of calcarea silicata. These are very interesting. Extremities of calcarea silicata will tell you only the lower side of it. In my experience, calcarea silicata has, it is my experience, it has not helpful. I might be in wrong case taking, I might be wrong in the case, but it helps best way in calcaneum spur. Usually we go for calcarea floricum, calcarea card, silica, ruta. We forget calcarea silicata. Calcarea silicata is a very good drug in eructations after. I'm coming to the stomach part. Good food, healthy food, but they have nausea towards food. They eat, but they have a nausea. This particular symptom has given, I think Dr. Qasim Chintanwala, my sir, he has given some part of calcarea silicata, or Adil has also talked on calcarea silicata and on stomach part. It is used in mucocutaneous junction from lip towards rectum. Mucocutaneous junction. It is a very good drug. But when it's upper part, go for higher potency, middle part, go for the milder potency. Again, in the lower part of the body, go for higher potency. This is specific what I have experienced. It is not a thumb rule.
If a case is complete, if a case is good taken, interrogation is good taken with the family, then think of calcarea silicata. But the potency is important. In the upper part, it is higher potency. In the middle part, go for from 30 to 1M, 10M. Again, in the low part, you can go to higher potencies, especially I will tell lentimeter potency, that is 50 milli potency in 5 to 6 liters of water, 7 to 8 pills, dose 8 tablespoon morning, 8 tablespoon night. And it is sufficient for 4 days. Mucocutaneous junction lips, it has also cured. It is also cured. It has also cured the case of cracked lips. Again, this part of lip, corners of lip, middle part is sepia. This part is upper lip. You can think of silica. This part, when it is not in winter, it is just contradictory. Winter mein we have a problem of cracked lips, but in calcarea silicata, it is moist, rainy season. Coming to the extremities, I told. I will talk now on cleavage of miasms, how miasms causes in calcarea silicata. Calcarea silicata, most of the people have told calcarea silicata as syphilis. Again, some people, Dr. Rajan Shankaran said calcarea silicata is of a ringworm. It's okay, it's his view. Calcarea silicata comes in psychosyphilitic trait because it has cured, it is giving clinical report towards mucocutaneous junction, yani fistula in, hemorrhoids and piles, where the discharge is nil, but there is a typical piercing pain, piercing pain in head, piercing pain. The calcarea silicata pains are typical, which goes from morning till 3, it is nil. After 3, and again it starts by 9 o'clock at night. It is typical of calcarea silicata. Calcarea silicata, the constitution or the temperament, I will say, they go thin, they grow sedentary, they are dependent usually on the close persons which they believe, not on those persons which he has taken help of. He will find any other person from the family and he will be attached with him. So I told in the mind session, they wants to be magnetized. It is very close, very, very close to calcarea carp. Calcarea carp, silica, nux vomica. Nux vomica is very attached with the family members, but he is not having a good rapport on family members. I was talking on cleavage of miasms in various seminars. I was asked what is cleavage of miasms. That whatever I'm not talking new. Cleavage of miasm is known to us. It is not used in practice. It is very difficult to understand, but it is very simple to practice. Actually speaking, there are only 3 miasms. Why people have met the factions of miasms, I don't know. Calcarea silicata is in the cleavage, whatever I told you, it comes in between psychosis, syphilis. I remember a case of pulmonary sinus where calcarea silicata was my last choice, but one dose cured it, completely cured. The skin over there, pulmonary sinus skin over there, completely healed. I remember a case of wet eczema where I went with, she had a very good history, typically of calcarea carp, moon phases, chili patient, everything. But she told me, whenever I clean the wet eczema, the pus is watery yellow. Watery yellow. I went to Boric and Boric repertory में देखे, Boric repertory में देखे. Then I went to Kent's laser writing. There it was mentioned. In such situation, you can try. Calcarea silicata is it is said it is a complicated, it is a simple remedy, but it is very complicated remedy where the miasmatic cleavage or the miasmatic problem comes in chronic cases. Acute cases, we can deal with many cases, many remedies, but in a very later stage, calcarea silicata has to be thought in relationship. The important part in calcarea silicata, silica, they never think, or they never tolerate contradiction in their life. उनको contradict आपने किया, so they will have a response. So it has cured fistulas, it has cured autistic child, it cured magic flora of calcarea silicata. Means I'll tell you what is magical flora of calcarea silicata. Calcarea silicata has music therapy in their mind always. Always. pardon me, music in always. They like music. They like very late music. Late music is a wrong word. A very light music. On this aspect, we'll tell you later because it will take a longer time to talk on CALCAREA SILICATA on music. The magical thing in CALCAREA SILICATA is that when CALCAREA, silica, lycopodium, naxomica, even sulfur, they fail to act. CALCAREA SILICATA acts as a nosode. You might be very familiar with the word when well-selected remedies fails to act. This to be given, this to be given, that to be given. I will add it to it. Silicata is the remedy that you has to use it in higher potency, not in lower potency. It acts well in higher potency. It acts minimal in lower potency. That is a law. That is a law. Means I have experienced 28 years talking about relationship of remedies with antidotes are the greatest remedy in homeopathy. But when it is given in higher potency, that is arsenic album. Arsenic album is the only drug which antidote or vice versa. Relations which are complementary is tuberculinum, silica. They are complementary. Sulfur is a complementary drug. Silica is also there. Drugs which comes in the complementary section are Calcarea florica. Hello, 1 minute. Hello. Relationships in relationships of medicine, antidote is arsenic. Arsenic is low potential. I will conclude my statement on big thanks to Delhi Homeopathic Association and everybody who have participated. Any questions if you have? What do we do? Hello.
हेलो डॉक्टर मिलिंद सर, आपकी जो वॉइस है वो बहुत ब्रेक हो रही है और बीच में थोड़ी दिक्कत भी महसूस हो रही है। मुझे लगता है नेटवर्क की ज्यादा प्रॉब्लम है, या तो किसी दूसरे मोबाइल से स्विच ओवर कर लीजिए।
ठीक है, मैं हेलो
जी जी सर।
I've started hello I've started my voice. It is audible now.
ये सर ऑडिबल है, लेकिन
हेलो,
बीच में बहुत ब्रेक हो रही है वॉइस।
ठीक है, हेलो
जी सर।
हेलो। हाँ, actually I have completed most of the things in CALCAREA SILICATA.
जी।
If questions anybody has,
ओके।
they can ask me.
ओके, दैट इज गुड। एंड डॉक्टर कल्पना, प्लीज।
Hello.
डॉक्टर कल्पना जी।
हेलो,
हाँ, बोलो बोलो।
ऑडिबल सर?
हाँ, it is audible.
ओके सर, थैंक यू सो मच सर, आज के इतना एनलाइटनिंग और नॉलेजेबल सेशन के लिए। राइट नाउ क्वेश्चन आंसर सेशन।
Right. Actually,
ओके सर।
I pardon you people because actually it was planned and it was everything is okay, but I went with my mobile homeopathy clinic and I am in such a village where I have to go for the network. Mobile network is not good over here. Hello.
नो वरीज सर।
You start with question answers.
Yes, sir. Here is a question from Dr. Harinath. The calcarea silicata is oversensitive to reapproach, looks skyward with the blankness without any purpose. So, इसकी ये जो लाइन आपने शायद इसके बारे में मेंशन किया था, आपके चैट में भी ये क्वेश्चन है सर। डॉक्टर हरिनाथ, अगर क्योंकि आज आप हमारे वेबिनार में पहली बार आएंगे, अगर आप अपना माइक ऑन करना चाहते हैं तो कर लीजिए, मैंने अलाउ किया हुआ है।
ठीक है,
जी
I will talk on this very in a very good way. This is a very good question. Blankness with blankness means I'm not looks skyward with blankness without any purpose. Purpose I explained to you. CALCAREA carb has oversensitiveness towards everything when there is his or her purpose of the position. Even the child, hello, even the child will repine or will complain to the mother कि मैंने ये किया नहीं है स्कूल में, और टीचर मुझे बोली ऐसा ऐसा है, ऐसा ऐसा था, आपने किया ही नहीं. He will not understand that. वो बोलेगा माँ को जाके कि मेरे को टीचर बोली है ऐसे ऐसे, मगर ही विल नॉट अंडरस्टैंड हीज निगेटिवनेस। उसका पोजीशन देखेगा कि मैं ऐसा था पहले, अभी ऐसा क्यों हूं। सो वी फाइंड it's a best remedy in open fontanelles uh, of child, or open fontanelles in the womb. हेलो हेलो,
जी सर, मैं
ओके
आवाज आ
सर।
रही है आपको?
are you satisfied with the answer, or I want to you want more explanation?
डॉक्टर हरिनाथ।
Uh,
जी
yes,
सर।
sir. Actually, he's known for having lot of nightmares, frightful, and then even in the sleep, that anxiety makes him sometimes start shrieking. This is the kind of things George Vitolka's book had explained about silicata.
George Vitolkas has also given a very good and explored feature of Calcarea silicata. Whatever you are talking of night features and nightmares, whatever Calcarea silicata has, that is because of his
Anxiety.
reprimand during his childhood. वो भूलता नहीं है। वो कलकेरिया का, आर यू गेटिंग मी?
Yeah, yeah.
कलकेरिया का कभी भी लाइफ में भूलता नहीं कि मैं वैसा ऐसा था। कलकेरिया सिलेगेटा कभी भी भूलता नहीं है कि मैं ऐसा था, मगर मैं ऐसा क्यों हूं अभी। बिकॉज ऑफ दैट he thinks, so he has nightmare.
Yes.
Are you getting me? And
Yes, sir.
that is a peculiar picture, that is a peculiar state of Sora. Hello.
And he becomes even forgetful, and then
That is a peculiar picture
yeah.
of Sora psychosis, Sora syphilis, Sora, or I will say psychosyphilitic cases. Any questions?
That's all, sir.
Huh? Hello. Any more questions?
Hello. If anyone want to ask any question, please switch on your mic, or just unmute yourself, and you can ask directly to sir. Okay, Dr. Kalpana, you please continue.
Hello.
थैंक यू सर।
हाँ, बोलो।
Yes, Dr.
थैंक यू सर। अब मैं हमारे पैटर्न सर डॉक्टर वीपी सिंह सर से अनुरोध करती हूँ कि वे हमारे आज के वेबिनार के लिए 2 शब्द कहें। वेलकम वीपी सिंह सर।
सबसे पहले तो मैं डॉक्टर पोरे का बहुत बहुत स्वागत करता हूं कि उन्होंने हमारे डीएचएमए में आकर के कैलकेरिया सिलिकेटा को इतना डिटेल में बताया। थोड़ा सा एक्चुअली मेडिसिन बड़ी हटके रही है हमारे सिलेबस से भी और थोड़ा सा प्रैक्टिस से भी, तो थोड़ा सा अभी दोबारा इसकी जरूरत है हमको। तो मैं डॉक्टर पोरे का बहुत बहुत धन्यवाद करता हूं और टीम को बहुत बहुत धन्यवाद देता हूं।
थैंक यू सर। अब हमारे दिल्ली में, हाँ जी सर।
I am very much thankful to everybody that patiently and with some disturbances you listened me.
थैंक यू सर। अब मैं अपने दिल्ली होम्योपैथिक मेडिकल एसोसिएशन के जनरल सेक्रेटरी डॉक्टर दीपक शर्मा सर से अनुरोध करती हूँ कि वे आज के वेबिनार के लिए 2 शब्द कहें।
Thank you, Dr. Kalpana. It was a wonderful experience about Calcarea silicata। और जब भी हम लोग कभी Calcarea silicata को पढ़ते थे, तो बस 2 ही मेडिसिन याद आती थी कि Calcarea कार्ब और सिलिशिया दोनों को एक साथ मिक्स करो और सिम्टम मैच करो और दे दो। हालांकि हमने जो मैंने अपनी प्रैक्टिस में यूज किया है कैलकारिया सिलिकाटा को, वो कुछ बॉयज के लिए किया है, एक पर्टिकुलर बॉयज। और कैलकारिया सिलिकाटा को मेरा यूज करने का जो पोटेंसीज थी सर, तो वो मैंने 12x से लेकर के 200x तक यूज करी है। इट वॉज वंडरफुल इन थेरेप्टिक डेज। और कॉन्स्टिट्यूशन में जैसा आपने आज हायर पोटेंसीज के बारे में सिखाया है, तो मैं इसको जरूर प्रैक्टिस में लेकर के आऊंगा। सो थैंक यू सो मच सर, आपने कैलकारिया सिलिकाटा मतलब एक सिंगल मेडिसिन पे इतने देर बोलना और इतनी अच्छे से एक्सप्लेनेशन देना, ये वाकई में काबिल तारीफ की बात है। कोई बात नहीं, नेटवर्क थोड़ा गड़बड़ रहा, लेकिन हमारी ये जो मेंबर्स के लिए जो वीडियो है वो यूट्यूब पे अवेलेबल रहेगी, उसको दोबारा सुन सकते हैं। और जो नेटवर्क है वो हमारे मन से मिलने चाहिए। तो जो इलेक्ट्रॉनिक नेटवर्क है उसका तो कोई बात नहीं, ये ग्लिचेस आते रहते हैं। सो थैंक यू सो मच सर।
थैंक यू सो मच सर। अब मैं
ठीक है।
हमारी प्रेसिडेंट डॉक्टर हाँ जी सर।
थैंक यू एवरीबॉडी। हेलो।
अब
I
यस
will be
सर।
very I will be very happy if you again invite me, but the topic will be on miasms. Nobody talks on miasms nowadays.
यस सर।
यस।
जी।
अब मैं हमारी प्रेसिडेंट डॉक्टर श्वेता मैम से अनुरोध करूंगी कि वह आज के वेबिनार के लिए 2 शब्द कहें, वोट ऑफ थैंक्स एंड हमारे स्पीकर के लिए सर्टिफिकेट। वेलकम टू मैम।
Thank you, Dr. Kalpana and Dr. Milind. It was a very enlightening session. बेशक थोड़े से नेटवर्क इश्यूज जरूर रहे हैं, लेकिन जो क्लिनिकल टिप्स आपने हमारे कैलकेरिया सिलिकेटा के से संबंधित दिए हैं, वो आई थिंक बहुत लोगों के काफी यूजफुल होने वाले हैं। सो थैंक यू फॉर शेयरिंग योर knowledge and wisdom with us. Please accept this appreciation certificate from the whole team of Delhi Homeopathic Medical Association. Congratulations.
ठीक है, thank you, thank you.
Welcome, sir.
Okay, चलो, good night.
Good night.
थैंक यू सो
Okay.
मच मैम। मीटिंग
Thank
एंड
you.
करें मैम?
Yeah.
Thank you. Thank you everyone.
Thank you all
Thank
for
you.
joining us
थैंक यू
today.
सर। थैंक यू एवरीवन।
Thank you. It was nice, Dr. Kalpana. Great.
थैंक यू सर।
Okay. Thank you. Thank you. मैम नमस्कार। बॉस नमस्कार।
सर
नमस्कार।
Namaskar, sir.
बहुत मेहनत की आज आप लोगों ने।
थैंक यू सर, सब आपका आशीर्वाद है।